Hello and welcome to another episode of Tea and Tales, where we talk about vets, pets, and share a cup of tea. I'm your host, Megan Taylor, and with me today is Dr. Theodora, emergency and critical care specialist. Yes,
Hello,
that's correct.
nice to join you.
Thank you for being with us. So today's topic is something that is so scary for so many pet owners. Like when emergencies happen, you don't know what to do, what's right, what's wrong. But even more than that, what is like an emergency and critical care specialist and how it's different than going to kind of your regular vet. So that's kind of the general idea for today. Before we get into it, can you tell us, basically what is an emergency?
What you just asked.
Yes.
Okay. Emergency from the side of the vet is a completely different way of thinking. Emergency is about 20 to 40 minutes of life or death decisions. And we need to switch from our everyday thinking and all the training that we've done, focusing on why is this animal sick, to how this animal is sick and what's going to threaten its life in the next minutes or seconds, and act on that.
And how did it become an interest to you to kind of go into this very specialist kind of career?
I think it's what I just said. The different way of thinking was a challenge for me. You have to accept that you will not know a lot of times why is this the situation, but you get to act in adrenaline and try to keep your calm and actually see right in front of your eyes the struggle to life and help with that.
I think you have to be so good, like on your feet, to be able to be in this field and like you said, calm, but
stress management.
yeah, exactly.
Yeah.
So when we were researching this topic, it kind of seems like there's 4 kind of regular emergencies that you tend to see. So kind of like poisons, accidents, trauma, breathing issues, and what was the last one? Bloat or blocked animals. Are these kind of the 4 main things you usually see, or?
Yes. I can add to bloat or blocked, let's put blood, 3 Bs in there.
The 3 Bs, okay.
But again, as you see, you are focusing on the what, why. But the how the animal is sick is a different categorization, and it's a different way to work at it. But this is how the owners will see it. So that's maybe a better way to go through what happened.
And since working in Dubai, how long have you been here now?
3 months. Almost 4.
And maybe it's too soon to say then. Do you see like different emergencies here?
Different than what I usually see.
Yeah.
Well,
Is it
definitely
country-specific?
the climate is a factor. You see a lot more of the heat interfering with the homeostasis of the animals, but basically the same stuff.
Or I always think you see so many. It's going to be the first one about the traumas. Like you used to work in the UK, right?
Yes. Well, there's a lot of drunk driving over there, so there's more car accidents. Yes, more car accidents. And not as many strays, so not many dog on cat or dog on dog fights. But yeah, basically.
Because here I always feel like there's so many, but I haven't worked in that many other countries. But falling from balcony cats, I'm like, they're just...
Yeah, that is something probably unique to Dubai, because there's so many balconies and and that is something unfortunate.
So if we think about trauma and accidents, like getting hit by a car, falls, fractures, what's the first thing an owner should think about if this kind of accident happens?
Well, the good thing about accidents, like we said, with thinking, you know what happened most of the time. Like you either witnessed it or somebody has, or it's quite obvious that the animal is bleeding or has been traumatized in some way. So there's no thinking. You just pick up the animal and go to the hospital. They're the best emergencies with regards to saving time, because people usually know right away that this animal needs urgent care.
It's an emergency. They understand that. Because I guess a lot of times as well, like people aren't sure what's an emergency and they're like, do I go to my regular vet? Should I just go to the emergency place? Like they don't know. But I guess when it's obvious like that.
Yeah. And the reason this is so difficult with animals and not with people is that animals, when they get unstable and when they get close to being in shock, they hide it, while people will voice it, and you will see the pain, and we will understand, oh, I'm not well, I need to go to the hospital. The animal is actually going to be, I'm not well, I want to hide. I want to get away. I want to go under the couch
Like they just
and not
get up
come
and
out
walk
for
off,
24 hours.
Yeah.
And it's also their mechanism of trying to get back to homeostasis. So their mechanism of trying to balance what is happening, preserve energy and heal. So that's where we need to be wary of that. My number one advice on that is trust your instinct. You know your animal better than anyone else. You spend more time with your animal, so trust your feeling, even if you don't know what happened or why it's happening. Trust your feeling and go for unwell. And with regards to the second part of your question, do I go to the vet, to my vet, or do I go to the hospital? It's not either or. One thing that I would like to make clear, and I try to make clear everywhere I am, is we have our own vet. We trust him. He or she knows our animal throughout history. We have a good relationship with him. And by all means, nobody can replace your own vet. But on an emergency, the different kind of thinking and the different environment and treatment you need to give is hospital. So trust your own vet. It's not a fault of your vet to tell you you need to go to the hospital or to refer you to an emergency. It is what needs to be done. And it's actually a benefit that your vet is able to recognize that and direct.
It's interesting as well because I feel like, especially in Dubai, so a lot of people, they'll have an emergency and they're like, I want to get to the quickest vet clinic. There's one like 5 minutes away. Let me just put the dog in the car, put the cat in the car and drive quickly to the closest one. And then maybe there's a hospital 20 minutes away. And then I think there's like a lot of like temptation, like let me just get to a vet quickly. But it's like, I don't know, what would you recommend? Is it like get to the closest one or you need to get to the emergency one, even if it's a little bit further? It's very case dependent. But I also question this myself.
Yeah, it's a very good question. And there is no right answer. Why? Because on an emergency, time is of the essence. But also, like I said, the way of thinking is different. I've been trying to find a metaphor that would explain this. There isn't any. Yes, hospital is different. Think about maybe your child. Would you go to your pediatrician or the closest pediatrician if your child is unwell, or would you rush to the hospital because you know that the pediatrician is not going to have
he's going to send you
the ability to, not even the equipment, but also the way of thinking to address an emergency. So risky, but my answer would be run to the hospital. Don't go to the closest. Go to the hospital.
Right. And then if we're thinking about accidents and traumas as well, like a lot of people will see the dog, he gets up kind of after the injury and they're like, let me wait and see. You know, he seems okay. He's not like bleeding. Yeah, I guess that would be what a lot of people look for. He's not bleeding, but he looks kind of fine. So they also will be like, let me give it a day or two and see how we get on.
Yeah, that is a big mistake, especially with cats. Cats will try to run away from the scene of the accident that happened. They won't vocalize. And like I said, they will hide. No. This is the time where, especially with trauma, we've witnessed what's happened. Don't give it time. Check it. Better be safe than sorry. Time is of the essence on any emergency and trauma. So even if it seems absolutely fine, your dog, your cat, and is walking and no pain, it's the adrenaline that is masking everything and damage is happening already. So as soon as possible.
And do you have any cases like that where you've seen, technically the cat kind of comes in okay on, as per the owners, like there was an accident and technically like as per the outward experience, he looks fine. And then do you have cases where you're just like, you were an hour away had you not come in from like the soul just falling apart?
Oh yeah. All the time.
All the time.
All the time. And especially accidents that don't have external bleeding.
Yeah.
Those are the worst because bleeding happens internal. Usually the bladder, which is, if it's full, it bursts. It's a surgical emergency. Also head trauma, neuro damage, internal contusions of the lungs. They develop later. Nature, we have to think of the wildlife. When the animal was in nature, when there was an altercation or an accident or it was damaged in some way, it needs to hide, get away from danger, and then heal. But here we have the opportunity to treat that, which is going to kill it later. So yes, don't wait.
Never wait.
That will be the
underscoring
yes, don't
today.
wait. Because if you know what has happened, let's investigate what has done to the animal.
So the next kind of big one that I'm sure you see very often is poisons and toxins. Actually, especially in Dubai, actually I see a lot of animals eating like rat poison or there's just poison left out for pest control. So what are the most common household items, though, that you will see get pets sent to ER?
Food. Food. Let's start with toxic. Raisins, grapes, onion, and garlic are things that we commonly eat, very much use, and we don't suspect they would be toxic. Chocolate. I think chocolate now.
Chocolate, I think people know, but grapes, I
Yes.
don't think people realize as much, especially when you have a small little dog and he eats a few. People are kind of like, whatever.
Yeah, the couple of raisins or that
Yeah.
food had raisins. Yes. Coffee is also bad. And then our medicine,
Yeah, what kind of or all of our medicines?
most of it, pain relief, let's say, for example, aspirin, paracetamol for cats, ibuprofen, all kinds of things that we have in the house. Just think again, pet, kid, think of your kid. Would that be okay? No, it wouldn't, even if they, eat some kind of food, it might be inappropriate. So, yes, there's a lot of things that the animal can eat in the house that would, and the animal would be attracted to eat as well.
Well, the medicine, I'm like, will it be, like it's so hard to pill a cat. And then this is the one time they're like eating these pills about it. But you see a lot of owners actually giving paracetamol to their pets, being like, oh, he was a bit, they
Yeah.
just kind of self-prescribed it. Do you see that quite frequently?
Not very frequently. That's a good. It's a good thing that we don't.
Yeah.
Yes. But yes, we've seen overdoses, or that vet gave it to me like some time ago, and it's inappropriate now. But I think mostly education, and a lot of people now have access to the internet, so they're going to go online. Oh, he ate that. Is it okay? And so we see less and less of that.
It's really great though for people to know if your dog eats the chocolate, honestly, you should check online the calculator.
The calculator, yeah. On the other hand, I wouldn't risk,
Oh, no?
even if the
Okay.
calculator says it's okay.
To be honest, the calculator always sends you to the vet anyhow. It's just so you like.
I mean, even if you don't have to make it vomit, at least come and get a paste that has absorbance, so all this chocolate will not be absorbed in the intestine when it goes through. So kind of try to balance this indiscretion of.
And what's your opinion then on people like, again, online you will find information about like taking the charcoal tablets, or people who maybe have them at home already. Do you recommend people to do anything if your pet has had something poisonous? Is your advice to like, you can try that, or it's kind of like, I'd rather you didn't start adding more stuff to the mix?
Again, we're coming back to the different thinking. We know what happened. Oh, the animal ate something, but we don't go into the how this will damage the animal, and that's where you need the expert. I mean, I understand people do not have the time to keep picking up their animal and running to the vets, but sometimes, as Americans say, a stitch in time saves 9.
Yeah.
So,
is that an American saying?
yeah. As talking to a specialist or bringing your animal to the vet to detoxify or to prevent any further toxification of what they have eaten might save trouble in the future. Let's say kidney damage, liver disease, gastrointestinal upset that's going to cause weeks and weeks of diarrhea. all that.
And you see that cats or dogs are more prone to these accidental poisonings?
Definitely dogs.
Yeah, dogs.
Cats will not eat things that are not good by accident. A dog would grab a dead, let's say, rat and eat the rat poison. The cat will know. No, dogs also, yes, and dogs will eat something out of spite or out of play. You're trying to get it away from their mouth,
Yeah.
and they will swallow it, so you won't get it. So
If we're talking about poisoning though in cats, flowers, lilies, like these kind of things. And it's kind of what you were saying, that maybe your cat has been around the lilies and it's all over their little face, but they seem fine. So you don't do anything about it. And then like you were saying, like 3-4 days later, now you're getting symptoms.
Exactly. So it's not just about so toxicities can cause acute damage or later delayed damage. And it's the delayed damage that is usually worse. When the kidneys are damaged, then we'll definitely need a lot of days of hospitalization, fluids, trying to get the kidneys back to functioning. So it would be so much better if the exposure, bring the cat in, let's detoxify, let's monitor, let's make sure this doesn't happen in the future and, save.
Yeah, it's like I'd rather just be safe than
Yes,
be
like, preemptive. Preemptiveness, especially in emergency, can save.
You've kind of already answered this one. What should a vet owner, or what should owners never do before reaching the vet? So we kind of said maybe not to give the medicine. People thinking about like forcing vomiting.
Oh, no. Things like that, no. Forcing vomiting is very dangerous, especially if you're not in the hospital, because aspiration is something that we quite see commonly as well. Also, home remedies, giving oil. I don't know. I haven't seen it here, but maybe I'm not here long enough. Giving oil to prevent absorption of a toxin, or peroxide to make vomit, and all those things.
You know what? Actually, I had a client and she said it's very standard in Germany, and the vets will like tell you to do this. But the sauerkraut, like the fermented cabbage.
Yeah.
She was like, every time my dog eats anything, they're just like, give him sauerkraut at home. I'm like, I didn't know that was such a...
No, the mentality behind it is that sauerkraut is a live culture, so you will get some of the good probiotic bacteria down the gut. But yes, if you take it, the advice as it is, then people do errors like forcing sauerkraut down an animal that has eaten a toxin that needs to come out. Also, not all things need to be vomited up. Some things need to pass the other way. Some things need to be drawn out, let's say foreign bodies that are not going to be absorbed. So again, trust your hospital and come to the emergency trained people.
And then you kind of already mentioned that too, but how quickly does the timing affect this? So if I come to you, like the dog, I got home, he's eaten something 4 or 5 hours ago.
So we do have this gut emptying window, which is about 3 hours on average.
So 3 hours.
So the stomach should empty every 3 hours, depending on what has been there before, how empty it is, hunger and all that, and breed and all that. So we have the 3 hour window where we feel that things will still be in the stomach. And why is it important for things to still be in the stomach? Because absorption starts after the stomach. So when things are in the stomach, we're still in the safe. We haven't absorbed all the badness that is included in the toxin. So we can vomit things up. After that, we're getting into a gray zone of the 3 to 6 hours where things could have moved forward or not. And then we get into detoxification. So as soon as possible. Again, it's becoming a theme now. Just run.
What's sort of the craziest things actually you've seen an animal eat? Or poison, or some most unexpected or something.
Oh my God. Foreign bodies, I think.
Foreign bodies.
Oh yeah, that's the highlight. And especially things that the animal, I'm sure, doesn't want to eat, but because we react surprised and scream at it and try to get it out of his mouth, he will swallow and win. And they're so proud after that. But then, and the foreign bodies that are really sharp, like glass, that the animal would never eat. Toys, socks, underwear. Dogs are.
Yeah, that's a common one. Dogs in the underwear.
Underwear is something that smells a lot like us, and it's very attractive. So laundry, yes, and the socks, the sweaty socks.
Yeah, the socks. I've seen a lot that eat like that. So we're moving in a bit to breathing distress, like asthma, heat stroke, airway collapse, choking, smoke inhalation. What does true respiratory distress look like versus kind of they're just panting?
That's a hard differentiation. A lot of what you put in that category is more chronic, like asthma is something that will come as an attack, but then we will know it and we expect it on cats, panting and all that. But respiratory dyspnea, you will know. Again, you need to trust yourself. You've seen your dog panting. Cats never pant. So if you see it, you will know it doesn't feel right. And I'm fortunate enough and I'm happy enough to see clients come back and they can't tell you what's wrong, but they're like, there's something wrong. I can feel there's something wrong, and that should be enough. And that's, again, the difference between an emergency vet and a regular vet. The regular vet would be like, okay, but what? Is he not eating? What? Looking for the symptoms, looking of what is happening, why? While the emergency will be like, okay, I trust you. I need to find out what is happening. Because with shock, we always see the compensation. And let's not get into that. But with regards to breathing,
I was like, elaborate on that.
Okay, all right, we can get into that. So when the animal is getting into shock, without getting into the definition of shock is the way to death, let's say, it has mechanisms to compensate. And so this is what we can detect. First, mentation is going to come down. Heart rate is going to come up. Respiratory rate is going to come up. And those are things that will come not because of, playing around or something like that, but they will seem different. And I believe in the owner, and the owner can see there's a difference in that breathing, and we need to trust that and investigate it. So with regards to breathing, any change in breathing pattern or any change in breathing sound, any change in breathing that you haven't seen in your animal, just bring your animal to the hospital. That's all I have to say. Breathing is always an emergency.
Always. Okay. And let me see. What can owners do about any breathing issues on the way to the clinic if they see them not breathing quite well?
Drive safely.
Yeah, don't panic.
Just drive safely.
Yeah.
Get someone in the car with your animal to hold the animal. Don't drive with your animal in the next seat, and drive safely. Focus on the drive. Get to the hospital as safe as possible. Nothing else. Turning the AC in the car, of course, but nothing else.
And then this one, I think, is a bit more subtle for people. If we're talking about like cats mainly, with like urinary blockages. And this one can turn like an emergency so quickly. But there's maybe more of these kind of like subtle signs. So why are male cats especially at risk for a urinary blockage?
Okay, that's a good question. I don't put blockage in an emergency because there's plenty of time, and usually your regular vet will see you and advise you and all that. It does need hospitalization, and sometimes it needs intensive monitoring, but it's not an emergency per se, like the 20 to 40 minutes that we say, but it is something. Why male cats? Because they're unfortunate. Their anatomy has a turn of the ureter. So with the cat, the ureter starts from the bladder, like with all animals, but then it has to turn right at a bony turn. And that kind of makes it difficult for things to pass. Also, cats have an emotional bladder in the sense that they do get their stress to cause their urinary system to inflame. And that's when we get bleeding or crystals and all that can cause blockage.
And how can you tell when vomiting or bloating becomes life-threatening? Do we consider bloat?
Bloat is always life-threatening because there is an obstructive part of the GI, but it also obstructs other things like
Let's tell everyone really briefly what bloat is actually as well, just to give a little explanation.
Bloating is when the stomach starts getting enlarged and big for several reasons, usually things not moving forward. It could be mechanically, so things are stuck, or it could be neurologic, it could be a twist, which is even surgical. But bloating is a small part of emergency. Again, we still have a little bit of time, but we shouldn't ignore it. And the signs are quite clear. I mean, the animal would be uncomfortable. There will be retching. There will be not feeling well. It should be usually after a meal, after something.
And there's some dog breeds that are more common to it?
Yes, the big-chested ones, especially if you feed and then exercise. A big full stomach that is heavy can twist on itself.
Right, you should never feed and exercise.
That's true.
And then one routine check every parent should not skip to kind of catch these, let's say like a blockage or something early.
Routine check. I wouldn't be able to advise you on a routine check, but I would say a routine way of thinking. Like, first of all, know where the hospital is.
Yeah.
For example, don't be a little bit preemptive, thinking, okay, this is my animal. I need to know what to do in case of an emergency. Maybe put a sticker on the fridge.
I think I see so many people online. There'll be like an emergency at night, and then they're posting in these like Facebook groups, like it's an emergency, like which vet is open, like in the night, and I'm like, no one's going to reply to this till maybe a week later. It's so aware to be like which vet clinics are open at night, which are the emergency ones. So like to have, like you said, a list on your fridge. I'll be searching on Facebook at midnight trying to find someone.
True. And also a little bit of searching. Like I said, this does not mean that you're betraying your own vet. Okay? Your own vet is going to be forever your own vet. And after the emergency, that's where you're going to go back to. But you need to understand that emergency is a completely different way of thinking. And you need to find a hospital that has a team that's always going to be there to treat emergencies. because I see there are a lot of hospitals, but they are, again, day hospitals. They don't have that emergency part of it. And it's such a different way of thinking that will make the difference. So know that about your animal and know where it is and have a plan of, in case something happens and I need to run, which direction am I running to and why? And do I need to give a call? And, all
That's
that.
such a great point as well. That you see many clinics also kind of advertise that we have like a night, like we're open for emergencies, but they don't have like a night vet. It's like if you call, we can send a vet, like who'll wake up, he's on call. But it's like it's such a good distinction of having someone who can, wake up in a few hours and get there, or like we have like a team who are trained in emergencies there.
Exactly. Not just the timing. I mean, of course, your vet, you've chosen them because of that and because they're going to be there for you, but it's the way of thinking. When you practice normal veterinary medicine, you have to think a specific way. You cannot switch to the emergency like that. It needs giving up some things in order to gain some of the thinking. And it's just the way it is. And you have to commit a team. And I mean, that is now finally happening in emergency medicine, committing a team and training a team to be able to think for those 20, 40 minutes an hour, that will be the difference between life and death for your animal.
Yeah, it's a good point actually. So many nurses would be great day nurses, and it's like they're able to like do everything more than well, but it's a different type of nurse that you want for the emergency. So for pet owners, what's the single most valuable thing owners can do today to be ready for an emergency? We've said having the numbers, doing your research.
Yes, knowing where to go and why. Getting that guilt out of your mind. Again, like I said, we love our own vets. They know our animal. They're the best. But the emergency is something completely different. And then trust yourself. Trust when your animal is unwell and you can feel it. It doesn't matter if you know what or why. Just trust what you feel. It's better, let's say like that. It's better to show up in the hospital, walk in, have someone specialist check your animal because you feel the animal's unwell, rather than...
And it be okay in the end.
Yes, yes, rather than...
Like I've taken this risk and he was not well.
I remember that emergency very fondly. It was around Christmas. Somebody brought me a wonderful dog. It was, I think it was a collie. And male, young, really good in shape, but they were adamant this animal is unwell. He's unwell. They couldn't say what, but they were just, please check him. He's really unwell. That's not him. We've checked everything, and I smiled because it happened to be an intact male, and there was a female dog in heat just 2 houses down the street. And it had just made him so, yes, he was so in love and so upset. But it was a very fortunate emergency.
That's funny one, actually. There must be so similar the symptoms. Like he's just...
Oh, yeah, he was very
not
different.
himself at all.
Yeah.
Thank you so much, Dr. Theodora, for speaking to us. For people listening, what's the best thing they can do if they want to find more resources on this, or how can they be more educated or aware about kind of what to do in emergencies?
It's so hard to give this advice because now the internet is full of things that want to impress you, they're not true, that it's dangerous. What I want to say that just keep rules in your mind. For example, any blood you see, it's better to treat right away. It's an emergency. Anything that has to do with eyes, just because our eyes are really sensitive and really painful, is also an emergency. Like we said, breathing. If breathing changes, if breathing is affected in any way, even if you cannot describe how the breathing is not regular, just investigate. Don't wait for it. And again, feeling that it is okay not to go to your own vets for everything. Your own vet is the guardian of the health of your animal, but an emergency is a completely different thing. You need to be able to feel it and act on it.
Yeah. Thank you once again, Dr. Theodora. And for anyone listening, if you have any questions, please leave us a comment, and Dr. Theodora will definitely try her best to answer all of them. Thank you for joining us.
It was my pleasure.
Thank you. This dog is like...
Yeah.
This dog is annoying.
Is it? Can we catch it?
It's all right.
Of course it's catching.
It's catching, huh? Oh,
It's
no.
like, but not that